Being an anaesthetist involves, most of the time, making someone unconscious so that they can safely have an operation. It's done in a very controlled, very predictable and very reversible way so that you can safely wake them up and provide good pain relief at the end. Now, because there's so many different types of patients, babies, mothers having babies, elderly people having heart surgery, it actually requires quite a lot of training to be safely doing that in an expert way in all those different scenarios. So there's quite a lot of training involved, and it's a busy job. People come in day and night and they need monitoring during operations, even long operations, and so it's a form of controlled intensive care. A workday in the operating theatre usually means coming into the operating suite and getting my drugs and equipment prepared and set up, meeting the patient if I haven't met them before and checking the information that's already been charted about their health and what they're going to have done, usually asking if they've got any questions or concerns which I can answer, and then preparing to put them off to sleep, which usually involves a needle in the back of the hand and then bringing them in and having a time-out, which is a check with the rest of the operating team to make sure we're all on the same page, doing the same thing, getting them off to sleep, and then once they're asleep, making sure their vital signs and the level of anaesthetic is all appropriate, watching what the surgeon's doing, documenting everything, and then getting ready to wake them up. And once I do that, once I'm happy they're fully awake, taking them out to recovery, handing them the patient's details over to the recovery staff, and then repeat as needed. That's on and on as the day goes on. What do I enjoy most about my job? That's changed a little bit. When I first started, it was very much about the enjoyment of being in a critical care environment, but with some control. So being able to put people off to sleep is putting them into an area which needs a lot of care and attention to their heart rate, blood pressure, etc. But being able to do it in a way that brings them out of it safely. It's very satisfying being able to provide pain relief or just relieve anxiety for a patient. But more recently, actually, I feel more enjoyment about being an enabler, so that our job as an anaesthetist is to enable good surgeons to do good things, good cardiologists to do good things, and that's very satisfying. Probably the most important thing with nervous patients is to ask them how they're getting on and what their main concerns or nervousness is about. You think you know, but often they will give you concerns that are often quite easy to address, or that you can answer that you might not have otherwise have mentioned if they didn't say it. And in actual fact, just if people are generally nervous, just asking about their health, about their home life, about, in a sense, just asking them about their lives is very distracting and often quite a relief for someone who's just waiting for an operation is the hard part. So common questions are, is this going to hurt? Whether it's having a needle in the hand, or if a woman's having a baby under a spinal anaesthetic, and that's usually very easy to reassure. Occasionally people will ask, am I going to be awake? And once again, it's usually quite easy to be very reassuring about that. That's my job, after all, to make sure they're asleep and then make sure they wake up at the end. And then interestingly, particularly in my area of work, elderly people are often asking whether I'm going to be the same mentally after an anaesthetic. A lot of people are worried they won't be the same again, and there's some lay concerns about that, and that's actually also very easily able to be reassured with the current evidence that we have. There's a lot of research going on into that area, but once again, most people come out pretty much exactly as they went in. Probably the most important piece of advice is to not be afraid to ask questions, whether that's before you come into hospital or even before the operation when you first meet the anaesthetist. There are plenty of times where you can and probably should ask questions if you've got concerns about the anaesthetic or about the operation. Most anaesthetists are very happy to be contacted even before you come into hospital. The surgeon usually has ways of making that happen if you need it. But that often allows, the unknown is often much worse than the reality, and people being reassured about what's going to happen is by far the best way to reassure people. So don't be afraid. A lot of people just submit to it, and in actual fact you might be relieved just by asking a few questions.